All right, so hi, my name is Sue Donovan. I'm with RIPIN, and this evening, the self-directed program at RIPIN is hosting a presentation. For those of you who are new, RIPIN has been around for 32 years. We are a nonprofit in Rhode Island serving consumers in the area of healthcare, education, and healthy aging. Tonight's presentation is being brought to the self-directed community. What is self-direction? Self-direction is a service delivery model for adults with intellectual and/or developmental disabilities and their networks of support, folks that are supporting our consumers. And self-direction is a model where the consumer is in control of their plan and they do the hiring and training of staff. So the self-directed support program is focused on building statewide capacity in order for the self-directed community to be able to access that delivery model. And we do that in different ways. We do it through training, resource sharing, peer support, referrals, and collaborating with many other agencies and organizations. This is our winter lineup, bringing us from January through April, and this calendar of webinars and events is available on the RIPIN website, and you can register for any and all of them. So at this time, I'd like to introduce Josh and Ian from the Sherlock Center, and they will be presenting for us this evening. And Josh, I am going to stop sharing so that I can hand the screen over to you.
All right, great. Thank you very much. So today we're tasked with reviewing some information about how work impacts benefits. Our overarching theme today is to say that, yes, work is possible, and yes, you can work and be receiving benefits at the same time. My name is Joshua Hughes. I'm a work incentive counselor with the Sherlock Center, and I'm joined today by Ian Arminstead. He's another work incentive counselor that works with us at the Sherlock Center as well. And I've just put our contact information here. Everyone will have access to the slides at some point in the next couple of days, so you'll have our contact information if you have any questions about accessing benefits counseling or any information that we share today. Feel free to reach out, and we're more than happy to answer any questions that anybody has. I'm just going to read a quick disclaimer. This presentation is for information purposes only. Social Security regulations and other information may change, so always check with the original source for the most up-to-date information. Okay, so our agenda today, we're going to review the benefits of employment. We're going to talk about accessing work incentives and how to access benefits counseling. We're going to review the differences between the SSI and SSDI program. We're going to talk a little bit about reporting earnings and different methods to report. We'll also review ABLE accounts and some of the benefits of ABLE accounts, as well as there's a whole plethora of resources that we have in this presentation. And like I said, everyone will have access to the links of the resources in this presentation once they get sent out. And if anyone has any questions as we go through the presentation, feel free to type those in the chat, and we can get to your questions at some point during the presentation. So feel free to ask any questions that you have. Okay, so the good news, you can work with benefits. You do want to learn how work incentives apply to your unique situation. So everybody's situation is different. You might be talking to a friend who's receiving a different benefit than you're receiving. It's important to kind of understand that every situation is a little bit unique. But in most cases, you're going to be better off financially by working. And also, in most cases, you're going to continue to have access to your health insurance, be it Medicare or Medicaid. We'll go over some work incentives a little bit later that will address how you can maintain those benefits. So the goal of this presentation is to show how you can work while on benefits without all of the horror stories that you hear. If you are able to have an understanding of how these benefit systems work, you can work with confidence and avoid overpayments and unexpected benefit issues. Okay, so most people associate work with a paycheck, which is a great reason to work, but there are so many other positive things that come from working. Work allows us to use skills that we've generated, but it also allows us to develop new skills and in turn develop new work goals. It also affords new opportunities for friendship and social activity. It makes life more balanced, satisfied, and meaningful. We hear all the time from people that we work with that, they're stuck in the house, they want to get out, and a great way to contribute is to getting back in the workforce if you're able to. Work is proven to increase better overall health and financial well-being. And while you're working, you're also paying Social Security taxes, which can result in eligibility for SSDI and eventually Social Security's retirement program. Okay, so we've decided work is for us, but we need some help finding a job, or we need supports to keep a job. Some agencies that help with these types of things are listed here. So the first one I'm going to go over is the Office of Rehabilitation Services. This is a state organization that helps individuals with disabilities get back to work. So they can help with job seeking, they can help pay for education or training. They also can provide some retention supports as well. There's also employment supports through the Rhode Island Department of Labor and Training. So you can look into that program for different training programs that they offer and hiring incentives that they offer to employers. We also have information about Skills for Rhode Island Future, which can also help with job searching. There's also Rhode Island Reconnect. Some housing authorities even offer job searching assistance programs. So if you are living in public housing, you want to check with your housing manager, see if they offer any sort of job supports. DHS has employment and training program through the SNAP program. So if you're receiving SNAP, you could access those services. And then through the Ticket to Work program, there are employment networks that offer employment supports. And we'll go over what the Ticket to Work program is a little bit later and how to access those supports. But that's another option for people to get assistance with searching for jobs or keeping a job, if that's something that you're struggling with. Okay, so if you can only remember one thing from this presentation today, it's important to understand that there are two different Social Security programs. When you're saying you're receiving Social Security benefits, you're going to fit in one of these two categories. You're either going to be receiving SSI or you're going to be receiving SSDI benefit. And there's a big difference between each program, and work also impacts each program differently. So it's very important to understand which benefit you're receiving. So someone who's receiving SSI, which is Supplemental Security Income, has little to no work history and little to no income or savings. So this is a needs-based program. You're going to receive an SSI check of $943 a month or less in 2024. You're going to be eligible for Medicaid once you are eligible for SSI. SSI is paid on the first of the month, and you're also going to get a small supplementary check from the state of Rhode Island, usually in the amount of $39.92 per month. SSDI is for individuals who have a work history or for individuals who are a disabled child or spouse of a qualified worker. So individuals in the SSDI program, their checks are going to vary based on how much they've contributed into the Social Security system. They're going to be eligible for Medicare after 24 months of receiving their benefits. And typically, SSDI is paid on the 3rd of the month, or it's paid on a Wednesday of the month. So, if you're the second Wednesday, you're always going to get your check on the second Wednesday of the month. And in some instances, if you're receiving a low SSDI check, you can also receive SSI at the same time. We call those concurrent beneficiaries. That's someone who's receiving, a low SSDI check and then a supplement from SSI. So they have to kind of pay attention to both sets of rules. So some important facts about benefits. So I mentioned this earlier, you want to confirm which benefit you're receiving. Are you receiving SSI? Are you receiving SSDI? Or maybe you're getting both. But it's important to know which you're receiving because you want to know which work incentives you're going to apply to your situation. There's different work incentives in each program. So you want to make sure, you're paying attention to the correct work incentives. We hear a lot of times people come to us and they're like, my friend's on Social Security, and they told me that this is how their benefit worked when they were working, but you're telling me something different. And, a lot of times you might be talking to somebody who's receiving SSI and you're receiving SSDI or vice versa. So it's important to really understand which benefit you're receiving. It's important to realize that your benefit consists of your cash check and also your medical insurance. And another big thing we hear is, I can only work 20 hours a week. Social Security is not concerned with how many hours you're working. They're interested in your total gross earnings per month. So they're looking at your earnings, not your hours. So that's an important thing to pay attention to when you're trying to figure out how to navigate these systems. You're always looking at gross monthly earnings. And if your benefit ends and your employment continues, your health insurance may also continue. So we're going to go over those work incentives a little bit later, that if your benefit, your Social Security benefit ends, there's some work incentives that allow you to keep the Medicare and Medicaid. So we'll go into those protections. So we talked about the importance of knowing which benefit you're receiving. Here's a few ways to verify, with Social Security, which benefit you're receiving. So you could go on your My Social Security account, or if you don't have one, you can create one, and it'll let you know which Social Security benefit you're receiving there. If you have a copy of an award letter from Social Security, it'll say on that award letter, supplemental security income or Social Security disability insurance. So you can check that award letter for which benefit you're receiving. Or you could call the Ticket to Work helpline and they can let you know which benefit you're receiving. All right, and I'm going to hand things over to Ian. He's going to go a little bit more into the in-depth on how SSI and SSDI work.
So the first thing I would like you to think about is if you could make up to $41,000 a year and still keep your health insurance, would you want to work? Because I know for myself, making sure that I have consistent medical insurance for all the things that I need in my life is almost more important than my paycheck. With SSI, the supplemental security income, it is possible to earn $41,000 a year, sometimes more, and still maintain Medicaid. So that's a really big thing to think about. There is no length of time that you can earn SSI and have work. There's no time frames of, I can only work for 3 months or 5 years, nothing like that. One of the basics of supplemental security income, the SSI, is that as your money from work goes up, that SSI amount will tend to go down. So Josh had mentioned that the maximum amount you can get from SSI in a month is $943. As you're earning money from work, that will go down $1 for every $2 you earn in general. And that Medicaid continuation we were talking about is something called 1619B. That's just the name of the rule that allows you to keep that Medicaid coverage. And for that amount of $41,109 in Rhode Island in 2024, you can earn up to that amount before you even have to worry about looking at how to keep your Medicaid coverage. And then there are ways to do so after that as well. So this is just a very quick example of how that math is done to determine how much you're going to get in your SSI check. So for this example, someone is working 24 hours a week at the Rhode Island state minimum wage of $14, because remember that went up just the beginning of this month. So there are a couple, we call them work incentives. They have specific names, the income exclusions. This is what's going to reduce that gross monthly earnings. So gross just means before they take taxes out, to the countable income. It's your countable income that is going to be subtracted from your SSI. So as you can see on the left, there are a couple of exclusions, deductions they make right away. There's the general income exclusion, the first part of the earned income exclusion. So that first $85 you earn in a month doesn't count towards your SSI check. They then divide that amount in half. That's the second part of the earned income exclusion. We also call it the 1/2 disregard. So that can show you how if you're making $1,455 a month, only $685 is being removed from that 943. And then if you look at the bottom, your total monthly income, so with the SSI check and the paycheck, is a lot more than just the SSI or the paycheck itself. One of the things that we talk about in the 1619B discussions is what's known as the break-even point. That's basically at what point will your SSI check be brought down to zero. In 2024, that's $1,971 of gross, so pre-tax earnings. If you're making less than that, you will still get an SSI check. If you make more than that, that's when we start looking into that 1619B for you, because you'll maintain your Medicaid and your SSI, even if your check is brought down to zero. There are some additional work incentives, and anytime we're saying a work incentive, what that means is a way for you to reduce that countable income for that math we showed on the last slide, to keep more money in your pocket. One that doesn't apply to everybody is the student earned income exclusion. So that is someone who is under 22 years old, who is in a school program. That can be high school, college, transition programs. There's a lot of definitions of what counts. They are allowed to exclude a lot more of their earnings, to the point where, for the most part, they get to keep all of it for a number of months. I forget the exact number now, but it's something like $8,000 a year that is just not counted. We covered the earned and general income exclusions already. We covered the Medicaid continuation under 1619B. The IRWIs and the BWIs we'll talk about a little bit later, but the plan for achieving self-support, the PASS plan, that is something that's only for people with SSI. It's a way for them to set aside money they get either from an SSDI check or from work. They can save that in an account to work towards that self-support. It's a business plan, basically, that you come up with, where if you need to purchase tools for work, or if you need to modify a vehicle to make sure you can work, these are things that can be set aside where you will not have to worry about that money counting against your SSI check. So I mentioned those impairment-related work expenses. These are things that you pay for out of pocket that are required for a medical condition that you're being treated for by a doctor, which is to say any of your disability-related conditions that you need to use for employment, that these can then be used as deductions against those earnings for your SSI math. These can be examples of doctor's appointments, medications, equipment, transportation to and from work, if you need specialized transportation. There is no list of what is or is not an impairment-related work expense. It's just more of a Social Security defines it, and then you request the deduction. You say, hey, I have this, I pay for it, no one else pays for it, I don't get the money back from insurance. Can we use that to reduce my countable income? And then they'll review that and say yes or no, and you will need receipts for that. Yeah, that's good for that amount. So this is just showing how those impairment-related work expenses, the IRWEs, work. So the same math as before. They're making $1,455. That's $85 is subtracted. The impairment-related work expenses are subtracted before the amount is divided in half, which means that basically for every $100 in impairment-related work expenses, you get to keep $50 more in your SSI check. These are already things that you needed to pay for, so it's just helping to keep some of that money in your pocket. So your your total monthly income would be slightly higher than if you did not request and have approval for those impairment-related work expenses. So the big horror story with SSI is overpayments. One of the ways that you can avoid your overpayments, first off, is knowing which program you're in. But now that you know you're in SSI, you need to report your earnings monthly. This is not something to help you out. This is actually a requirement of the program. You are required to report your total gross earnings, so the gross amount of all your paychecks added together, by the 6th of the month following. So at the end of this month, you have all of your paychecks. You need to report that information to Social Security before February 6th. And that makes sure that they have the correct information so they can make the deductions they need for your March SSI check. If you understand that formula that I showed you, the math, you'll understand how they make that amount determination, and you'll know if you're maybe not getting the amount you're supposed to. If you get more than you're supposed to, hang on to that. They're going to ask for it back. It's better to have it already, and then you can call them and let them know, and they can get you through how to get that back to them. Otherwise, they come with those letters saying that you've been overpaid, and then you have to make a payment plan. But there is that 2-month gap. So the money earned this month, you report next month, and then it shows up in the check after. So Medicaid is the health insurance that comes with SSI. This is something that's very helpful for people when they are working, because we all have doctor's visits and prescriptions and everything else we need to do to keep ourselves healthy. that 1619B protection, that is what makes sure that you can maintain your Medicaid health insurance, even if your SSI check goes down to zero. There are some rules to that. You need to have had SSI for at least 1 month. Those SSI payments need to have stopped only because of earnings. There are other rules to SSI, like making sure you have less than $2,000 in your bank account or resources, making sure you fill out all your paperwork when it's asked for. You still have to do all of those things to keep your Medicaid with 1619B. And then I had talked about that $41,000 earlier. That is a general threshold, they call it. At that point, if you are making more than the $41,109 and you still have additional Medicaid expenses that are above average, that's based on an average number, they can come up with what they call an individualized threshold. So you can maintain your Medicaid even if you have more than that amount in earnings, if you have high health costs. And say we're gonna, say that you got a big promotion, you're making a lot more money, you're way above that $41,000 threshold. There is another option for Medicaid. It is what's called a buy-in. So you're basically buying Medicaid as you would any other insurance program. In Rhode Island, it is known as the Sherlock Plan. We do not run the plan. It is still all administered through the Department of Human Services. It's just named for the same guy. So in order to have that Medicaid buy-in plan, you must be working. That's one of the requirements for eligibility. You have to have earned income. The premium payment, how much you have to pay each month, is on a sliding scale. Most people, when I'm talking about this with them, will be on that $0 scale. It goes up to $92 currently. But there are also much higher resource limits with this Medicaid version than with the SSI Medicaid. You're able to have $10,000 as an individual or $20,000 if you're married of resources. So that's money in the bank or saved before there's any sort of Medicaid issues with that. We also suggest the Medicaid buy-in for people who are receiving Medicare through SSDI, as it works as a supplemental insurance plan for them. So for Social Security disability insurance, I'm just going to call it SSDI from now because it's a very long name. Working with SSDI is a decision. It's not a number. So we had said earlier that it's not how many hours you're working, it's how much money you're making. There's actually more to that than that as well. So for SSDI, again, there's no limit to the length of time you can work. 4 years, 30 years, that doesn't matter. But there is something called the substantial gainful activity amount. That is how much you are making each month. So in 2024, $1,550 a month of countable earnings. Again, it's based off of your gross amount, that pre-tax amount, but there are deductions you can make to get that countable earning amount. When you first start working, you will start off in your trial work period. Your cash benefits will continue regardless of how much you're making in your trial work period. When you start earning above that trial work period amount and you get into your additional stages, that $1,550 amount becomes important. If your SSDI payment stops because you are earning at or above the substantial gainful activity amount, your Medicare health insurance may continue for at least 93 months. That's 7 years and 9 months after your trial work period ends. So those phases in SSDI, there are 3 of them. The first one is called the trial work period. You get your full SSDI check no matter how much you're making, and you have 9 trial work months. In 2024, anytime you make more than $1,110, it counts as a trial work month. Once you've used all 9 of your trial work months, you move into phase 2. That's when the substantial gainful activity amount becomes important. If you are making at or above that $1,550, that's when your SSDI check will pause. It doesn't end, you just won't get your check that month for any month you're making above that amount. If your earnings go back below, you have less hours or anything like that, you contact Social Security and your check will restart. After you have ended your extended period of eligibility, if you're still earning above substantial gainful activity, that's when your SSDI would end, it would terminate. But if anything changes with work or your earnings and you go back below that amount, you can request expedited reinstatement for the 60 months, the 5 years after your benefits end. And then you can get back on your SSDI benefits if you're unable to continue working at that level. So there are work incentives, so those rules to reduce your countable earnings in SSDI, just like there is for SSI. And some of them we already talked about, those impairment-related work expenses. The blind work expenses I didn't mention during SSI, and I apologize. The blind work expenses are the same as an impairment-related work expense. It's just that it would have to be for an individual who is blind and where they come in the math. So those are actually subtracted after that 1/2 division, not before. So a $100 blind work expense would keep $100 in your SSI check. For the purposes of SSDI, that $100 blind work expense or that $100 impairment-related work expense work exactly the same. It's a dollar-for-dollar deduction from your income. There's also something known as subsidies and special conditions. In a previous job, I was a job coach. I would go to work with people at their job site. That would be a special condition. That is something that would reduce the earnings, the countable earnings for that individual at that time. A subsidy is something that the employer provides. If it's a reduction in job work or expectations or productivity, that can reduce the countable earnings for the time at work. Income averaging for people who have months where their earnings go up and down, up and down. If the average amount is below that SGA, Social Security will use income averaging and say that you can keep your check. And if there's also an unsuccessful work attempt, if you are not able to continue working at that substantial gainful activity amount, after 6 months, like you try, you start, you're doing well, it doesn't work out, you come back down below that $1,550. Social Security may call that an unsuccessful work attempt and make a decision that you had never actually reached substantial gainful activity, so benefits would continue as before. There's extended Medicare coverage, just like there's the extended Medicaid coverage, just with like with SSI. So a subsidy is an example here. There's talking about there's Manny, who is a bagger at a grocery store. Manny does not work quite as quickly as his coworkers, but he gets paid the same amount. So this is not like a sheltered workshop or piecework where you only get paid by how much work you do. Manny gets paid the same amount of money, but his employer is okay with him working slightly slower, getting slightly less out. That 15% slower that Manny is allowed to work is a subsidy, and that amount, which is $255, would be subtracted from his gross earnings to come up with that countable income versus to make that SGA decision. So same thing with SSDI. Overpayments are something that we want to try and prevent. You're not required by the program to report monthly in SSDI. I still suggest you do so. Just make it part of your habit, part of your process, because it makes sure that you keep all your pay stubs, you have those handy, you have a organization system for them, because one thing that is in SSDI that is not in SSI are work activity reviews, where Social Security can come and ask you for the last 5 years, 7 years of your pay stubs. If they don't have those numbers reported, they're going to want those paper copies from you. I recommend people report their earnings monthly using the My Social Security account online if they can. That is the best way to make sure that all the information is recorded in Social Security's computers. But you can, whatever way is working for you now, keep doing so. And that you also definitely want to contact Social Security if you're receiving any checks at a time when you think you should not be. So if you're after your trial work period, you're earning above that $1,550, you get a check, you probably shouldn't. You want to contact Social Security to let them know so that they can say, yes, it's yours to keep, or, oh no, we made a mistake, we need that back. Because they will come ask for it, and you want to make sure you have it available. So
Okay.
Back to Josh now. Thank you.
I'm jumping back in. Thanks, Ian. Yeah, so wage reporting. This is, another really important thing that you're making sure you're doing if you're receiving SSI or SSDI. If you're reporting your wages in a timely manner, it's the best way to avoid overpayments or other issues that you could have with your Social Security payments. So it's important to keep your pay stubs. You want to keep track of those, keep them in a shoebox or something, have some sort of file system where you're keeping all your pay stubs. If you do have impairment related work expenses, you want to keep those receipts and also report those to Social Security as well. And then it's also a good idea to always keep any correspondence to and from Social Security. Social Security sends you a letter. It's always a good idea to keep that, because if you do end up working with a benefits counselor, it can help us kind of understand where you stand with Social Security. So who is responsible for reporting wages? So ultimately it is the beneficiary's responsibility, or if they have a rep payee, it's the rep payee's responsibility to report the wages. So when you first start working, you want to contact the local Social Security office and let them know that you're now working. They'll ask you some questions about how many hours you're working, what's your pay rate, and they'll put you in working status in their system. Also at that time, you want to talk about any work incentives that you may be using. So if you know you have impairment related work expenses, or if you're a student, you want to talk about those specific work incentives, because you do have to request them in order for Social Security to implement them for you. And then also discuss the different reporting options that Social Security has available. Every office is a little bit different. And we have a link here to kind of go over some of those reporting options. But like Ian mentioned earlier, there's the My Social Security account, which can be used for both SSI and SSDI beneficiaries. SSI also has a wage reporting application for like Apple and Android smartphones. You can do it the old-fashioned way, bringing pay stubs to Social Security or faxing them or mailing them. You just want to pick one way and stick with that same reporting method as you continue to work. Okay, so everything we've gone over today is kind of basic surface level stuff. Benefits counseling is a service that can help you answer those more specific questions that you have in regards to how work impacts your specific benefits. Like I mentioned earlier, everyone's situation and benefit package is a little bit different and unique. So a benefits counselor is able to look at each benefit you're receiving and help you plan and anticipate what will happen when you're starting to work. So, things that a benefits counselor will go over with you are the impact of earnings on your SSI or SSDI, the impact on your Medicaid and Medicare. We can give recommendations if we think, you'll be ineligible for your current Medicaid plan, but we think there's a different Medicaid plan you'd be eligible for, say the Sherlock plan, like we talked about earlier. We would give those type of recommendations. We also give information about how work impacts SNAP and also housing benefits and any other sort of benefits that could be impacted by working. We also look at your unique situation and the different work incentives that Social Security offers, and we give you recommendations on what we think some work incentives would be that you would qualify for. We also review the wage reporting options like we just talked about, and talk about how to avoid and reduce the risk of overpayments. We have a link here to our Sherlock Center work incentive page. There's a lot of different resources on that work incentive page. And we also have pre-recorded sessions like this on our website. So if you want to, listen to some of this information, we have a SSI focused webinar. We have an SSDI focused webinar where you can kind of learn a little bit more about those two programs if you do know which benefit you're receiving. If you are interested in receiving benefits counseling, there's a few different ways in Rhode Island that you can access benefits counseling. One way is through the Ticket to Work helpline. So that is a helpline that's run by Social Security. And helpline referrals are sent to the Rhode Island WIPA project, which is housed here at the Sherlock Center. So those referrals come directly to us. If you're a client of ORS, you can discuss benefits counseling with your VR counselor, and they can refer you for benefits counseling. And then the third option is if you are someone who receives services through BHDDH, the Department of Developmental Disabilities, you can submit an EERF form. This is an online form that you can fill out. I know that a lot of the people on this webinar today are self-directing services. So there's a link to the form here on this slide, and there's some instructions on how you can submit the form. But essentially, it asks for like basic demographic information, a little bit of information about the job, and the second page is where you can accept benefits counseling. Those referrals are also sent to us here at the Sherlock Center. So if you have any questions about navigating or which pathway is best for you to receive benefits counseling, don't hesitate to reach out, and we can definitely help you out with getting connected with a benefits counselor. Okay, so the Ticket to Work program. Most SSI and SSDI beneficiaries are entitled to a ticket, and this ticket offers you a couple of different services. One of them are vocational supports. So you can access services through ORS, which would activate your ticket, and that would allow you to get job searching supports, things we talked about earlier when we talked a little bit about ORS. The Ticket to Work program also has employment networks, which are community agencies that provide a whole array of job searching and job retention services. They all offer a little bit different levels of support, but you can go on the Ticket to Work website, and we have a link a little bit later in our slides, which will direct you to that work site. You can explore the different employment networks that are out there and pick one that makes sense for you. One of the big benefits of having your ticket active with Social Security is they will delay any medical reviews that you have upcoming, as long as you're making timely progress with the Ticket to Work program that your ticket is assigned to. So some people are concerned when they return to work that Social Security will think they're no longer medically disabled. This allows them to delay those medical reviews while you're making timely progress with that agency. Okay, so ABLE accounts. So with SSI and Medicaid, you're only allowed to have a certain amount in resources. Ian talked about that a little bit earlier. But if were disabled prior to the age of 26, I believe, or if you're disabled prior to the age of 26, you're eligible for an ABLE account. And Social Security and Medicaid do not look at money in these accounts as a resource. So somebody who opens an ABLE account can save $18,000 per year for disability-related expenses, and it won't be counted against your resources. If you're working, you can even save more than that. And SSI recipients can save up to $100,000 before their SSI cash payment is affected. And Medicaid continues even if savings are above $100,000. So it's a good way for people who are trying to save for, it could be anything. There's a lot of listed approved expenses on the ABLE accounts website. So if there's something some people might want to save for a car or something like that. It's a good way to allow you to save some money while you're working and yet still be below those resource limits. And family members or others can contribute to ABLE accounts up to the annual limit. It doesn't just have to be the beneficiary. Family members are able to contribute as well. Okay, so I know that was a lot of information. I'm going to take some time for people to type questions in the chat if you have any questions about anything we've gone over today. Okay, I see a question here from Nathan. Do you have to fill out a form for Medicaid 1619B, or does it start automatically after SSI ends? Does DHS notify you if Medicaid ends when you reach 41,000? So the 1619B work incentive is automatic. So, if your SSI check is going to zero because of your earnings, you should automatically go into 1619B status and your Medicaid will continue. As far as DHS notifying you if you were reaching that income limit, I don't think that's something that they would notify you. But you're going to want to report wages to DHS. And if you know that you're earning above that threshold, you'll want to request the Sherlock plan as an alternative to 1619B Medicaid. Does that answer your question, Nathan? Not seeing any other questions yet. So I'll allow for people to kind of type in the chat while I go through some resources that we have here. So we have the Sherlock Center website posted here, as well as our front desk phone number. We ask that you stay informed. We have a work incentive mailing list that you can sign up for on our website. where we send updates and information about different webinars and events that we have here at the Sherlock Center. We also have fact sheets and general information on our work incentive page, which you guys all have access to.
So Josh, there is a question from Susan, if we could give an example of an IRWI. So those impairment-related work expenses, I mentioned that they do have to be related to your disability. I wear eyeglasses. I'm not legally blind. My eyeglasses wouldn't count as an IRWI, regardless of how much they cost. I'm hard of hearing. I do need hearing aids to be able to do my work. If I was collecting disability, I could request that my hearing aids, that durable medical device, could be used to discount my earnings. For something like that, they would typically break it up over a couple of months. But I know some folks who require adaptive equipment for work, screen readers, transportation. I've used, again, previous job as a job coach. I know one of the guys I was working with, he was using Uber to get to and from work, and that was a accepted IRWI. You can have there's no list of what is, and there's no list of what's not for the most part, but there's a definition of what an IRWI is. And that's something that I think if you are getting close to that amount, you definitely want to talk to a benefits counselor, because we can help you find what those might be.
Yeah, and then we have a bunch of different links here for additional resources. So I mentioned that Social Security worksite. We have a link to the Working While Disabled pamphlet. It's a great kind of everyday people language explanation to what we talked about today. Something you could always reference back to for some basic information. We have some reporting earning fact sheets, which Social Security has put out, as well as a SSI calculation sheet. So Ian kind of went through those SSI calculations. There's a blank worksheet here you can use if you're on SSI and working and want to anticipate what your check will be.
We have another question in the chat. D. Smith asked, does the job training costs come from the self-service services, the support person who assists the workers on the job site? If you are using that ticket to work to get vocational supports either through ORS or through an employment network, it would not come from your self-directed budget. What that ticket does is it's providing access to the services and additional funding. So if you currently do not have an employment contract with any agency currently in your self-directed budget, the ticket to work program is a way to tap into additional resources.
Okay. Just some more resources that we have on this page. Disability Rights Rhode Island Legal Services, some job support resources, the American Job Centers, which used to be called Network RI, ORS's website, and that is it. So if anybody has any more questions, we'll be happy to answer those. And I want to thank everyone for attending today, and hopefully this information was useful.
Thank you so much, Josh and Ian. That was excellent, very helpful. And Josh, I'm going to ask you to help me out by advancing
Sure.
the slide. So next month, we invite you all to come on February 27th to our Community Connections. It's the Self-Direction Connection, and we will be doing it online. We'll have 3 different breakout Zoom rooms, one for consumers receiving services through BHDDH, one for family members, parents, caregivers, and another room for professionals. And in the professionals room, we do anticipate folks that are direct support professionals, perhaps plan writers. We welcome you all to join us next month so that we can talk about what resources you're looking for, and to, again, build more capacity within our community. If you could advance. And your feedback is really important to us. We look at all of the surveys that come in, so please use the link here, or you can use the QR code to fill out our evaluation form. It's very brief, and this way we can continue to improve the services and the programs that we offer in the community. And this will also go out with the recording in a couple of days. If you've missed one of our trainings, they're all online now. You can check them out on our website. Again, we have our QR codes, and any of the webinars can be seen on the RIPIN website. We also have contact information. On the next slide, we have email, self-directed support@ripin.org, and one of the staff will get back to you. Sarah has just put the link to the survey in the chat. If you didn't catch it, you can grab it from the chat. And again, RIPIN's phone number, we are open 8 a.m. to 5 p.m. Monday through Friday. And we look forward to hearing from you. Thank you so much.
Yeah, thank you, everyone.